Washington Post. Now, again, this is Jeff Bezos's Washington Post, okay, reporting that for the very first time, vaccinated people make up a majority of COVID deaths. This is the Washington Post headline just a short time ago. Vaccinated people now make up a majority of COVID deaths. That is the headline. And so I want to go a little deeper into this, which is I would say a bombshell story.
Yes, it is, but it's an analysis of data. They are just, under normal circumstances, they might post this as a bombshell story, but for the most part, it's just, here's the data, guys. We'll see how much the mainstream media picks up with it.
It's important to tell us where the data came from. It came from the CDC.
Right.
So the data came from the CDC that the Washington Post covered. Okay, so let's go through what the Washington Post says about the CDC data. For the first time, it says, a majority of Americans dying from the coronavirus received at least the primary series of the vaccine. 58% of coronavirus deaths in August were people who were vaccinated or boosted. Now, this is from August's data. This is not even September yet. According to an analysis conducted for the Health 202 by Cynthia Cox, vice president at the Kaiser Family Foundation. It's a continuation of a troubling trend that has emerged over the past year. As vaccination rates increased and new variants appeared, the share of deaths of people who were vaccinated has been steadily rising. In September 21, vaccinated people made up just 23% of coronavirus fatalities. In January and February this year, it was up to 42%. That was January, February. Per our colleagues, Fannette Narapil and Dan Keating, we can no longer say, they say, this is a pandemic of the unvaccinated.
You hear that, politicians?
We can no longer say this is a pandemic of the unvaccinated. From the Washington Post, quoting this analysis from the CDC. Here is the CDC data you can look for yourself. The Washington Post links right to it. Rates of COVID-19 cases or deaths by age group and vaccination status and booster dosage. So you can dive right into it and see it. Now, we should, of course, point out that the very last paragraph of this Washington Post story, you couldn't let us off easy, right? With just like the straight facts. You have to add in this part at the end here. Here's this quote on boosters. Being unvaccinated is still a major risk factor for dying from COVID-19. But efficacy wanes over time. And an analysis of last week from the Centers for Disease Control and Prevention highlights the need to get regular booster shots to keep one's risks of death from the coronavirus low, especially for the elderly. So that's from the Center for Disease Control. Make sure you're still getting your booster shots, says the CDC.
I don't understand how they work that out from the data. If they're telling us that more vaccinated people are dying, why this paragraph makes no sense.
Yeah, that paragraph frustrated me.
How can we?
It's like,
go ahead.
Because it's like the vaccinations are, more people are dying from that, but more people are at risk without it. Like,
right.
It's like you're saying the complete opposite thing.
But they are not giving us really the risk. We don't know because we have no COVID. We have no trials, especially for the booster that's out right now. That to say something like this, you should be able to quantify it and say, we know that this booster reduces your risk of transmission or pathological COVID or hospitalization. But they can't because they only tested it on 8 mice and said sometime in December they would get around to human trials. So how, I ask you, can they say this when they just presented us with data showing the exact opposite thing?
It's a great question. It really is a great question. And, so if you can't answer those questions, you try to cover for these groups, right? And so the Atlantic came right out with a nice article saying, and the good stooge that they are, the Atlantic magazine. I've seen a lot of garbage coverage from the Atlantic magazine over the past couple of years. They really are the worst. And here's their tweet just a few minutes ago. Paxlovid, the antiviral drug, has been widely available since last spring. Yet the number of COVID deaths per day in the U.S. hasn't budged. One problem, writes Rachel Gutman, is that people aren't taking it. Who are these anti-paxers?
Oh, that's a clever new one, The Atlantic. I bet you were proud of yourself for that.
Are you guys an anti-paxer? You won't take
Yeah, now the
Paxlovid?
left
That means
has
you're
got a new one to call us.
anti-paxer. Anti-paxer. So you
Okay.
won't take it. You're an anti-paxer now. Okay. So Dr. Fauci, though, as he was leaving, he had a good message. He had a good message to tell all of us about what we should do. This was his final message to all of you before Thanksgiving and around the world. Like, just pay attention to Dr. Fauci. Here's what he had to say. I'm sure he's privy to this data, right? It's been there. He has access to this data. So here's what he had to say at the podium. Watch.
So my message, and my final message, maybe the final message I give you from this podium, is that please, for your own safety, for that of your family, get your updated COVID-19 shot as soon as you're eligible to protect yourself, your family, and your community. I urge you to visit vaccines.gov to find a location where you can easily get an updated vaccine. And please do it as soon as possible. Thank you.
Yesterday, and so, I mean, this is a big week for Dr. Fauci. Yesterday, he gave his final COVID press conference. And then this morning, he was sworn in for a deposition as part of a lawsuit alleging that he colluded with big tech companies during the pandemic. There's a number of players in that lawsuit, right, to what their collusion was like. And what was the heart of the collusion piece of this? Like, were they conspiring with big tech to censor content to make sure that if they saw things that they didn't like about, masks, or they would censor that content?
Well, beyond that, yes. Did they also, get a pass for any kind of critical look at vaccine trials?
Right.
What was, and we saw Fauci sort of going after any doctors who wanted to speak out about this and asking tech companies to, make those doctors' lives miserable. We've seen several doctors deplatformed for just speaking about their own data and their own research. So how much of a hand did he and the U.S. government have in this, in censorship of information that was that the global population needed?
8:00 this morning, Dr. Fauci was sworn in for that deposition to give his testimony. So we're going to be watching very closely, like, what that testimony, has to say over the next couple of, we're going to see as this starts to unpack what